Clinical reasoning is a term that you're going to hear throughout your physiotherapy degree, and certainly much of your physiotherapy course is around developing your clinical reasoning skills. So what is clinical reasoning? Clinical reasoning refers to the thinking and decision-making processes that you undergo as a health practitioner. Now, there's so many different domains of thinking and decision-making that need to happen within our practice. That can be around understanding the client's story, it can be around diagnosis, it can be reasoning about and making decisions about what interventions that we need to use, it can be around interactions with others. So certainly clinical reasoning is quite complex and involves a range of capabilities. Interactive reasoning is one aspect of clinical reasoning practice. And interactive reasoning refers to the skills that we use to develop, establish and maintain effective interactions with clients and others. So in terms of the therapeutic relationship, interactive reasoning is going to be a key aspect underpinning how you monitor, adapt and change your interactions with clients throughout your time with them. So in terms of reasoning skills, what sort of skills do we need to interact well and be able to make good decisions about how to interact? Well, firstly, we need knowledge. We need knowledge of ourselves. We need to understand the lens that we look at the world through and understand our own experiences and how they might influence our decisions when working with this client. We also need interpersonal knowledge, so knowledge of the client, their illness, and the potential experiences that may be happening. Okay, so we can gather that information by talking to them and really trying to understand that person, and that's going to help us make decisions about how we interact and how we keep moving forward in this particular relationship. We also need to be able to process lots of bits of information at one time. So while we're talking to the client and gathering their story and trying to understand them, we need to be reading what's happening in their body language, their tone of voice, and also in the words they say to interpret how we're going in terms of this relationship and how comfortable the person is in terms of this relationship. We also need to be able to reflect. As we're taking in all this information, we need to think about our own decisions in how we're interacting, the tones that we're using, the word choices that we've got, and how we're setting up our own body language. So we need to monitor and adapt those things in response to what's happening with the client. We also need social and emotional capabilities. So we need to have some experiences and have some ability to interact with others. And we also need to understand and be able to pick up some of the emotional responses that are happening within clients. And be able to respond to those things within our interaction. As we've already highlighted earlier, the context will also influence how that interaction is going. So if you're noticing that the environment is noisy or it's a difficult environment for the client to relax in, you might need to make a decision about changing that environment in some way to help with that relationship.